us here know that we need to change how mental health is perceived and do our bit to ensure that mental health is viewed as every bit as important as our physical health. But I'm proud that Northern Ireland is leading the world with this progressive legislation which aims to remove the stigma associated with mental illness.
We believe it's time to get it right, to end the historic injustice and commit the investment and turn those words in the Bamford Review and other reviews such as Transforming Your Care into reality that delivers parity of esteem between physical and mental health. Mental health must be viewed the same as physical health. It can no longer be, as we hear described, the Cinderella services.
One of my fellow panel members asked people to stand up if they wanted to see change in the way that mental health was treated and viewed, and every single person in the room stood up. And it was one of those moments where you just felt really united, and that was quite special, I thought.
That you count and that I count. So stand with me if you want to see change within life.
If optimum mental health is over here, and being as mentally ill as it's possible to be is over here, right now, every single person in this room falls somewhere along that spectrum. Because you all have a brain, and therefore you all have a mental health. And that mental health will fluctuate throughout your life because you're a human being.
It's a really positive day, the first Action Mental Health Summit. Really looking forward to the breakout sessions this afternoon, building on the discussions we've had this morning about moving mental health forward in Northern Ireland.
Delighted to be here. We represent the charity. It's such a really good place to be. I have had 2.5 years with it. I've been so happy with it, and all the people that run it, they're all the same.
If you have a physical disability, as in a cancer, and you're off work 2 years, you get back into employment because you've had a physical disability. However, it's totally different with a mental health issue. People are always saying a relapse, they're always saying, not too sure about you.
It is clear that the underfinancing of mental health services in Northern Ireland is a long-term issue that will worsen unless the local assembly intervenes.
I am recommending that the mental health commissioning agencies in the statutory sector should continue to work with voluntary sector organisations to improve collaborative working in the planning and delivery of mental health provision.
I recommend that commissioners of mental health services and providers in the voluntary sector should continue to work together to promote a recovery ethos.
I'm recommending that Commissioners of Mental Health Services should review services available to meet the needs of people in Northern Ireland who have experienced transgenerational trauma as a result of the Troubles.
My recommendation is that the Department of Health, Social Services and Public Safety, in conjunction with the Health and Social Care Board and Trusts, should establish a working group with service users to examine how quality assurance systems can be improved.